Hey everyone, it's Johnson Changyan, founder of Sage House. I'm here with Dr. Amy Morris, the founder of Awaken Chiropractic.
Hi everybody.
Yeah, and we're here today to talk about the womb.
Yes.
The womb.
The womb.
Tell us about
AKA
the womb.
the uterus.
The uterus. Yes, tell us about the uterus, the womb. What's the health of the womb?
Yeah, well, it's such an important part of women's health, and so often we forget about it because we can't see it. But the womb is actually, it's about the size of your closed fist. Of course, it sits right above the pubic bone. And the womb, it's really just kind of actually floating in there. It's attached by ligaments. And of course, it's supported by the surrounding tissues. But the womb can actually shift position. And sometimes that can cause imbalance in a woman's cycle. It can cause irregular cycle, menstrual cramps. It can cause frequent urination.
So do people typically come to you to treat their womb because someone said, hey, you need your womb treated? How does someone know? How do you know that I need to go look? Because you do something called Abdominal Womb Therapy.
Yes.
So how do I, if I were a woman, how do I go, oh my God, I need to see a womb specialist?
Yeah, well, people actually do. Women come and find me when they have, chronic pain with their cycle, but also after childbirth is really common, just wanting to rebalance things. I'm wanting to heal after childbirth. Some women come to me when they're preparing to try and get pregnant, especially if they're having fertility issues, or if they're really just wanting to prepare their bodies and make sure that everything is healthy and working well before they start to carry a child.
So what goes on in a session that do you manually help shift things through touch? What do you do in a womb therapy session to help prepare for birth, let's say?
Yeah, so the first thing I do is I assess where the womb is at, so I can feel the positioning of the womb and feel if it's shifted to one side or the other, if there's more tension on one side of the abdomen. And then I start actually balancing out the body and preparing the body through these different acupressure points all along the legs, the buttocks, the back, and that helps to prepare the body. And then I do the work directly on the abdomen. So it's actually the whole abdomen. Holding specific points, breaking up some of the scar tissue or tissue that's tense. A lot of times tissue that's tense can actually cause things like fibroids and cysts. So it's really getting deep into the abdominal tissue, getting the circulation flowing as well. And then at the very end of the session, it's actually a lifting and realigning of the womb. So it is using my hands and pressure to realign the womb.
I've come across a lot of women who have fibroids or cysts, UTI issues. They also people with heavy menstrual cycles.
Yeah.
There are people with post or pre-menopausal issues, hot flashes, issues that are related to these are all issues related to the womb.
Yes,
right?
Absolutely.
And so now, from your professional point of view, does core work help or does it hinder? Does rotational work in movement help or hinder the flow of what's happening?
Well, I think it can do both. Honestly, I think it depends on where a woman is at and what type of movement and how it's taught. Yeah, especially postpartum. Women need to be very careful how it is that they're moving and twisting their bodies and making sure they're engaging things properly.
What would be the most important muscle that they need to engage?
The transversus abdominis. You're looking for that one. Yeah, absolutely.
Tell us about the transversus abdominis.
Oh, it's the deepest core muscle, and it's a really big part of the pelvic floor. So the pelvic floor muscles are a really important part of a woman's health because when we lose that muscle tone, then everything starts, well, actually, we can have a lot of problems like incontinence, but also just creates instability in the body.
And what about people who are premenopausal? You talked a lot about post-birth. Mm-hmm. What about before? How do you help someone like that?
Really the same way. Just doing the abdominal therapy is going to help them to balance out their cycle, balance out what's going on in their bodies. And, trauma is stored in the body, so it helps to balance things out.
And are there any surprising stories that you have that, someone, like, let's say a byproduct or something surprisingly wonderful happened to someone after they had abdominal therapy?
The woman that really stands out for me is she came to me and she was preparing her body for pregnancy, but she'd had extremely painful cycle her whole life. Like just would have to stay in bed, such severe pain. And I kind of expected that it would take some time for her to, get rid of that pain completely, that she would have to do a lot of the self-care. But really, immediately after the session, she had no more pain in her cycle after that. And I think she was as astounded as I was.
Wow. Mm-hmm. And what do you think about all of the medicines that people are prescribing to women that have these issues? Because I hear this a lot. I have a lot of women clients, and they're always complaining about their menstrual flow. So what do you think? And they're all taking drugs.
Yeah.
So what do you think about that?
Well, I think that interferes with what's really happening in the body. I mean, of course, sometimes medication is necessary and can really help us, but unfortunately, if there's already an underlying imbalance in the body, the medication is just covering up the problem. So that's why I really try to encourage a natural approach first, so we can help the body to balance itself out. And then if that's really not working, then we consider medication after that.
So thank you so much, Amy, for speaking today with me about the health of the womb for women's health.
Absolutely. Thank you so much for the opportunity to share about what I do.
Yeah, so if you have any questions about your womb or any of the issues that Dr. Amy has talked about with incontinence, hormonal issues, heavy menstrual cycles, etc., do send us a message over to info@sagehouseasia.com and to book in a session with Dr. Amy Moritz. And tune in next time for more informative talk sessions with other practitioners.
Great.